Well, the controversial NHI bill will become a reality if the ANC returns for another term in office, of course. I'm joined now by health policy expert, Dr. Bandile Hadebe. Thank you so much, Dr. Hadebe, for being in studio and, of course, joining me here on today. Of course, the President, NHI bill, it's been a hotly debated topic for the past few months. From what you heard the President say today, that he will eventually take his pen and sign that bill into action. Yeah. What's your take on that?
Look, I think we must contextualize the very concept of it being heavily contested, right? I don't think anyone is actually opposed to the NHI. I think different stakeholders have got reservations with particular clauses and with particular discussions that are coming out of the paper. But if you think about healthcare in general, it's always political because whoever gets it right gets the hearts of the nation. So you will find that even if the ANC loses tomorrow in May, whoever comes in is going to try to implement a certain version of NHI. So I think we must discard this concept that NHI as a policy is flawed in its entirety. I think those that have got contestations have actually pinpointed the errors that there is. So if you look at BUSA and B4SA, for instance, they've poked holes in Section 33 of the bill, which essentially threatens the existence and the continuing existence of the medical schemes, because they want to protect their private sector gains and profits and all those kind of conversation. And so they would naturally have reservations against that particular section. There's other bodies that have raised certain sections where they've got issues. I mean, if you look at the generics manufacturers in the pharmaceutical space, they've raised issues about single exit price, but it's specific things. So the one point that I think we need to dispense with is we don't really have an opposition to NHI. I think people have got specific issues where they've got reservations. But that's the one part. I think the biggest danger with this conversation is that we've presented the NHI as the silver bullet that's going to fix our healthcare. And it isn't. If you look at the strengthening of healthcare systems, there's about 6 areas that you need to touch on. You need to touch on service delivery, you need to touch on infrastructure, human capital, leadership and governance, information systems and technology. If we're not fixing all those things together, the NHI is not going to fix them.